Hi there. Thanks for watching Canceling COVID. I'm Tonya Rivens. So glad to have you join us on this Wednesday afternoon. This is a place for real people to have real talk and find real solutions. We have great conversation. We're working together to protect ourselves, our families, and our way of life during a global pandemic. It's still going on. I saw somebody the other day said, please stop saying post COVID because COVID is not over yet. And they're correct. It's not over yet. Of course, I'm grateful for our sponsors, Mecklenburg County Public Health. MECCountyNC.gov, MECCountyNC.gov. I said that kind of funny. Mecklenburg County Public Health, that is. MECCountyNC.gov, or you can call 980-314-9400. Also, Groundwater Solutions. We're grateful for their support as well. And Dr. Black will be joining us in just a moment. Now, the day we warned you about is here. That's right. This Delta variant, the deadly and highly contagious one that has now been around. It came from India, and we were concerned seeing people bodies that were actually having to be burned in the streets because it was so overwhelming. Well, it has now spread to just about every state in the US, and with half of the country still not fully vaccinated, there's reason for concern. Doctors warn of a COVID-19 spike just as children too young to get vaccinated get ready to go back to school. Yikes. We've been talking about this, and so now we're getting ready to deal with it. So states like Los Angeles, California, states like California rather, and cities like Los Angeles are trying to be proactive and are once again making masks mandatory. Yes, those masks haven't gone away. So regardless of the vaccination in LA, you have to wear a mask. So that brings us to our question of the day. Will mask mandates become the norm to prevent a Delta spike in the fall? So that variant is here in the US, and of course in the fall when the seasons start to change, that's oftentimes when we see outbreaks of other diseases. So do you think the mask mandates will become the norm to prevent a Delta spike in the fall? And we're talking about the Delta variant of COVID-19. Please chime in. I see you hopping on, so I'd love to see your comments. Love to have the conversation. You haven't been very chatty lately, so hopefully today this is something you would love to share. And of course, do you think the Carolinas will follow suit and actually bring back the mask rules? Do you think we should? A lot of places you still have to wear your mask. I know it's optional in some places. I was surprised even in the bank where I visit, it was optional. But when you go to some other places, especially around children, it's pretty much required. So we're going to go ahead and hop into our conversation today. And it's Dr. Tracia Black of Groundwater Solutions. She's joined us every Wednesday, and I like to bring her in and just have a conversation like we always do. She always drops some really good nuggets, and it's been a week. Seems like it's been far too long. I say that all the time. It's always good to talk to you, Dr. Black. So good afternoon to you.
Good afternoon to you too. It's actually been 2 weeks. Last week,
that's right.
Earl Owens III stepped in on my behalf. So I hope you guys enjoyed talking with him.
He did a wonderful job, and I love you could hear the passion in his voice, and he was sharing. He's just really has a love for our community, like you and I. And he was just saying, conversation, talking to people, explaining to them, and it helps open so many doors. And we've been saying that all along. And sometimes it's got to be a one-on-one. It doesn't take. I know you try to grab as many as you can with that net, and you go for the millions or the thousands or the hundreds. But sometimes you have to come smaller, and the whole grassroots efforts works a lot better if you're trying to really change these numbers. Baby steps, but you get there eventually.
You get there. I was at the Biden event in North Carolina last week. I think we're going to talk some about that later.
Oh, yeah, and Raleigh.
One of the things that he talked about was knocking on doors, going door to door. I think that's effective, except, sometimes people might not like strangers knocking on their doors, but
a lot of times now.
Yeah, the message is having conversations, those smaller opportunities to have dialogue with our community members, with our family members, with the people that we say we love. Be willing to talk to them about their health. Be willing to talk to them about COVID-19 and how do we stay safe in our home and within our community, because that's what's going to make the difference, those one-on-one conversations. Because we've heard the media, we hear it on the news. So if it's not working to keep us safe, then we've got to start having the conversations with the people that are in our circle.
I agree. So let's go to the question of the day, Dr. Black. With the spread of the Delta variant, do you think mask mandates will be the norm?
Well, I don't know if they will or not. I think they should be the norm. I think that our states were premature in lifting the mask mandates. And I am concerned when I walk in places and I see no mask, because I know based on the percentages that there's a still a large number of folks in that crowd, wherever we are, that are unvaccinated. And so
Right.
with the Delta variant, it just brings in more um, hesitancy or more alarm about the safety of those folks out there, both who are not vaccinated and are young people. I'm very concerned. So I hope that the mandates return until we're fully through this pandemic. I just don't know if the states have the wherewithal to reverse, to go back. I think,
Yeah.
some are saying the conversations that I hear at the state level is regression. Are we willing to regress? Well, I think what we have to understand is that COVID is going to be around a while longer.
Right.
It could be a year, 2 years, 3 years. And I've said it before, we have to learn to live with COVID. So that means that there should be times where we mandate masks, and not to be afraid to make that decision to do so. So I think with the Delta variant, it's absolutely necessary that masks stay in place. And I hope that the states do mandate that. I just don't know that they will.
Yeah, because unfortunately it was allowed to be politicized. And so that whole thing just to, someone's personal opinion in a high leadership role was more self serving and not thinking of the 600,000 lives that we lost and
Mhm.
jeopardizing millions of lives. And
Mhm.
so it became a political issue. And so I can see where it's tough now for some places to try to walk it back because it's been made, it's a political, a hot potato,
Yeah.
so to speak. But what are your thoughts on a spike coming this fall? You want to share how likely that is, or what do
I,
you think?
I think it's very likely. I think that those of us in the COVID testing arena, we're seeing the numbers go up.
Mm,
We're seeing folks who are sick with the Delta variant of COVID-19. I
wow.
shared with Amelia, the producer, the show's producer, that, and I sent her a video. Maybe we'll watch it next week, or
Okay.
one of the weeks. But there was a group of young people who
There
went on
she
a
is.
missionary trip. Oh, she showed it.
Yeah.
Yeah, and some of them came home with COVID. They're just getting home, and they do have
Oh,
the Delta variant of COVID, and so we know that it's here. We
yes.
also know that it is particularly harmful for young people. And those are the ones who very rarely will wear masks. Those
Right.
are the ones who usually are not vaccinated. So if that's happening, and those young folks are coming and being around our seniors, or young adults or older adults, then we have the possibility that it is going to spread, and that there will be a dangerous spike.
I'm just curious, how long did it, we saw the images from India, and I keep referring to them because that seemed to be the country that really, when they had to start burying bodies in the
Hmm.
streets, do we know how long that cycle was running? The question of the day is, do you think the mask mandate will become the norm for a lot of places here, and especially in North Carolina, as we head into the season of the
Hmm.
Delta variant? But did anyone track how long that cycle did run in India? Are you aware of it all?
I am not aware,
Uh-huh.
but I do know, with regard to the Delta variant, we've been seeing the Delta variant since earlier this year. And
Okay.
there are potentially some cases from the end of 2020. So it
Mm,
has been here for a moment. And we saw in 2019 how
mhm.
quickly the virus initially spread around the world.
Right,
So
right.
we first started hearing, a little bit in October. By November of 2019, we knew COVID was attacking around in different places around the world, and within a few months in the U.S. we were shut down. So
Yeah.
if the variant started, say first of 2021, we're in that period now where it's now showing up here, and we're going to potentially see those numbers rise, similar to the original COVID-19 virus. The good thing is that a portion of our community is vaccinated.
Right,
So
right.
we're hoping that we don't see those same types of numbers. We're believing that the COVID-19 vaccines that are out there now are going to provide some protection to with regard to the Delta variant, but we know that there's still some risk. And
Right.
so we don't want a repeat of where we were this time last year. And if masks will protect us from doing that, then I hope that any kind of light bulb will go off for our legislators, for our leaders, and just for every person, that they will realize, I need to put a mask on. It's
Right.
kind of simple if we
It
really
is.
think about it. And Just put something. I've got a new face shield. I should have brought it on today. So I'm wearing that now instead of a mask. I'm more comfortable. Those are more readily available. So if you're at that point where I'm just sick of masks, consider the face shield, and you'll have a different experience.
Well, you're
But
gonna have to
cover
bring it
up.
in model, yeah, model it for us next week. That'll be really good. Now let's talk about Dr. Fauci. He said last night that pretty soon there will be two Americas as the gap widens between the vaccinated and the unvaccinated. What comes to mind when you hear that?
Oh, I've thought that for a long time when I've seen the kind of benefits that go to community members who are vaccinated.
Right, right,
Again, we've talked about the different seating sections in restaurants and the seating sections in sporting events.
right.
I know that concerts are coming back. So I do think that there are going to be privileges that are allowed for those who are vaccinated that are not going to be available for individuals who choose not to be vaccinated. I think it is going to be a very kind of divided and separate society. I think we're going to see those in the workplaces. I
Mhm.
know that here in Charlotte, there are they're wanting every all state and government employees to return back to the workplace because
Right,
many of them are still working remotely, but they're wanting them to return back, but only if you're vaccinated,
right.
in house. So you're going to have those that, it's going to be a different lifestyle if you're vaccinated. I believe that is going to happen.
Well, the World Health Organization says that the spread of COVID-19 is outpacing vaccinations. So the longer COVID spreads among the unvaccinated people, the more opportunities it has to mutate.
Mhm.
So the Delta variant is just part of the problem. That's not the
It
whole
is part of the
story.
problem
Yeah.
because this is how virus mutate. Now, say in COVID can live outside of your body. We know that, so it can live on surfaces, but it cannot mutate on surfaces. Viruses can only mutate inside of a host. So that means somebody has to be carrying it. Now, our goal is to get to the point where there are no carriers, there are no hosts. But as long as there are hosts and people who are at risk for COVID-19, inside the host is where variants occur. So there are potentially, you know, different numerable brand or variants that could occur. So our goal is to try to eliminate the host. We can't eliminate the variants, but if we can reduce the number of hosts, then we reduce the risk of these variants taking place. So right now we have the Delta variant. We are prayerful that there will be no more variants. And again, if we stay safe and there are no hosts, then there will be no more variants.
Well, let's talk about your mobile unit. I saw it
Yeah,
out this weekend. Yay!
you
I was like,
did.
whoa. They
Mhm,
pulled up and I was like, what? Groundwater Solutions? I don't know if we have a picture of it or not, but I am so excited and so happy for you. Talk
mhm.
about it a little bit.
So we have a mobile unit. And again, the mobile units initially have been dedicated to COVID-19, where we take the units out to perform testing across the state and vaccinations across the state. We are now expanding into full health care inside the mobile unit because there are communities in North Carolina where there's just no access to health care. The nearest
Oh,
medical provider is an hour away. And
mhm.
many of the individuals in those communities don't have transportation. So we are our
There you
goal is
go.
for those units. Great, thanks.
Yeah.
Our goal is that our units are able to provide that necessary health care, both for COVID-19, but for all health challenges that our community faces. So we're partnering with medical providers, specialists to be able to take those services right there into the community where people live. We've gotten such great response, and folks show us love when we travel. We go
I
to
mean, look
churches.
at it. Come on. I need it for a tailgate for a football game or
All
something. My
right.
goodness, when you pulled it up, I was like, what? I didn't mean to
Mhm.
cut you off. I
That's okay.
really just
We're
can't
excited. I
enjoy it.
love
Thank
it when we go out just because that is the response that we get, and folks aren't used to seeing that out there. We did were able to take the mobile unit up to Raleigh last week. President Biden was supposed to tour the units, but
you.
did not get the opportunity to tour because of the schedule. But he
Right.
addressed them in the speech. He talked about the need for mobile units and to be able to flood our states with them so
Right.
people get what they need. People
Yeah.
have not not had access to health care. That's why we have these underlying conditions, particularly in the Black community, that we can't address because people who want health care don't have access, or if they have insurance, they don't have the doctors. If there are doctors there, they don't have the insurance. And so we're just trying to fill that gap so that it's there. Whether you're insured or uninsured, you don't have any reason not to take care of your health. We're going
Well,
to bring it right to your neighborhood.
so you mentioned President Biden. First of all, I'd be glad to have one of those campers, mobile units. But if it could be a camper on the weekends, of course,
Okay.
provide the service during the week. I just love. I mean, so nice and such classy job. So great artwork, the wrap, everything looks really good. But you mentioned, and we had a picture of you in Raleigh when
Mhm.
President Biden was there. Kind of tell us what that was like.
It was exciting. I have never seen a sitting president of the United States, and it was just an amazing
Oh,
experience. The energy in the crowd. Um, President Biden himself, he was so personable. And even after he spoke, he walked around the crowd. Like you could just literally walk up to him
uh
and
huh.
talk to him. You could shake his hand. He would take your cell phone and take a selfie with
Oh,
you and he. And it was very for an hour and a half he walked around, and everybody there said they'd never seen that from a president, or even was shocked that the Secret Service allowed him to walk around. I made so many connections with
yeah. I
that
saw
was
you that picture there with some
yeah,
people.
that picture is with El Centra, which
Uh
is
huh.
a Latina
Latino.
based organization. And so we've made some partnerships and we plan to do some programs with them. So
Good.
everybody who was there were first responders to the COVID-19 pandemic and have been on the ground the entire time, making sure this community stayed safe. And it was just a celebration. So it was exciting. And I'm so glad that we got the opportunity to be invited.
That's good to know that you were there. I know Minister Corinne Mack, she was there as
I
well because
saw
I
her.
was
She was
talking to
dressed up in beautiful green.
was
Oh, she
she?
looked
Yeah,
gorgeous. Yeah.
shout out to her. I just I was talking to her about something else, and she was actually it was the meeting that night, and so she was
Hmm.
getting trying to maneuver. You know how we do
Yeah.
multitask, and she did a good
Yeah.
job holding it down. So you talked about we already talked about the door to door, the suggestion of going to neighbors, but some people are a little bit reluctant to open their doors right now. But we did talk about grassroots, and President
Hmm.
Biden, hit on some of those things. What are some of the other takeaways you got from him? Obviously, he's a personable guy, regardless of what people
Hmm.
say. He's a
Hmm.
seasoned veteran. He's been known to be diplomatic.
Right.
It's a real challenge right now coming behind. To say the last act is a tough act to follow is doesn't even scratch the surface. So, but
Right.
the whole issue at hand is trying to cancel COVID. So, what were some of the other takeaways?
I think again, like I said, the door to door, if that's an option and you can participate and do it safely, but find ways to bring up the conversation about COVID-19 in
Mhm.
your circle. We had in my family, we had a meeting on Monday, and
Oh,
we decided it was a health and strategic planning meeting. How are we as a family going to stay safe? And myself, my brother, and my mother called that meeting, and we
mhm.
said, we're going to do this every month just as a check-in to see where we are. And
Mhm.
wasn't specifically and strictly about COVID-19, but we talked about that. We talked about the need for us to stay
Right.
vigilant in our safety, in our health, but also to address any health issue that we have. Because the dangerous thing with COVID-19 and the vaccination is that it can exacerbate existing health conditions.
Yeah.
COVID-19 doesn't necessarily it will make you sick with cold like symptoms, but the
Mhm.
problem is if you have an untreated um, a health issue that you have not addressed, then it's going to make that worse. So let's address the health conditions. If we're healthy, then we can even if we catch COVID, we're going to live through it.
Yeah.
And I say that to other folks just to say, whatever you've put off, maybe you're not treating your hypertension, maybe you have diabetes and you're not addressing your blood sugars, you're not going to the doctor, you're not tracking and taking your sugar levels every day like you're supposed to. Those are the things you got to do so that you can live through COVID or anything else that comes out. So it's time for us as a community to just start working, start taking little baby steps. if we can. I like giant steps, but take baby steps. If
Right.
all you can do is get out the door and walk a little bit, do something to address your health.
Yeah, and that's a very good point. And so hopefully people will start focusing on
Yeah.
their health. And it's
And I
great to
think they,
hear.
again, they need to talk about it.
Right.
You have family members who may be struggling with the health issue in silence. So we kind of, with my family, we laid it on the table. What you got going on? We had
Yeah.
real talk. Tell us what's happening. What's on your mind? What are you worried about? If it's some folks financial issues and that's stressful, which can lead to health concerns. So
Right.
we need to return to that village mentality where we don't stay in our corners. We come out of isolation and we reconnect with each other. We've been so separated over the last year out of necessity, but it's now come together. Let's look and what have we learned from the last year, and let's keep it moving forward. So I encourage everybody, call a family meeting. Let's just do a checkup. That's what I call it. And we'll do our checkups every month. So if folks want to join in, do those checkups. If you need help, you can call me and I will help you facilitate a family checkup.
I love that. And that's
Hmm.
probably one of the things, obviously, one of your takeaways of something to implement after
Hmm.
coming from that conversation or that meeting with President Biden and the whole
Right.
group there. So that's a
I think
great
the
idea.
the key is do something.
Right. Do
Do
something.
something. Figure out what your it is going to be and just do it. It's time for us to come off of the sidelines. And that's what I heard Biden say. He also talked about social injustice
Yeah.
and inequality. He said that his number one objective in his administration, yes, he wants to address COVID-19. He wants to
Uh-huh.
end COVID-19, but he wants to end racial injustice and
Wow.
inequity. And in every department, he's made that the top of the list in every area of his government, that racial inequity will be addressed. So I admired that. Of course, we are proponents of that. And COVID-19 is just evidence. It brought forth, it highlighted the injustices in our community. And so we've got to fight those too and just be an advocate and be a champion in that race.
Good, good stuff, Dr. Black. Tell us where you are today. What is Groundwater Solutions doing today?
We're at three different locations today. We're at University Adult Care
Okay.
in Charlotte, North Carolina. We are at Kittyland Daycare in Charlotte, North Carolina, and Your Destiny Alpha Learning Center. I believe that is in Salisbury, North Carolina. I know the group was in Salisbury this morning. We are also out. We'll be this weekend. We'll be here in Charlotte at our office at 5104 Reagan Drive, and we will be in Kinston, North Carolina. The city is throwing a festival, so we'll be there with all the festivities. So come out. You also know you can call our office, 704-596-0505, and receive a COVID vaccine or test Monday through Friday. We're available.
Good, good stuff. And of course, groundwater-solutions.org. Any final thoughts, Dr. Black?
No, I'm excited. I don't know why I feel a sense of excitement today.
Yeah.
I woke up with that sense of excitement and that
Good.
just a sense of expectancy. I'm
Yeah.
expecting something great. We can't walk in fear. Well, we will survive this and we'll be smart. And I just want us to be smarter on the other end.
Well, thank you. Thank you for sharing that energy here. We can
Yeah.
tell in your voice and but you always come with great energy and great perspective anyway. So Dr. Tracia Black, we certainly appreciate you. Groundwater Solutions. Enjoy your weekend
Thank
and
you.
enjoy the holiday, but make sure you are safe as well. Still looking for your comments. I know I mentioned the holiday. I know around the holiday time people are thinking about their long weekend. So I won't press you too much, but I would love to hear your comment about the mask mandate if you expect for it to become another something that's going to be implemented as a result of the Delta variant that's now here in the US. Let's look at some other news. More proof that COVID-19 booster shots may not be needed, which is encouraging for many of us. A study published Monday suggests the vaccines have more long term protection than previously thought. And people who don't like taking shots, we can appreciate hearing that, are taking vaccinations. Let me say it that way. Okay. Meantime, North Carolina is extending its statewide eviction moratorium. For now, I thought I read that Governor Cooper, I need to verify that. Unless it changed, I saw a report where Governor Cooper made the recommendation, but that it was decided that the moratorium wouldn't be continued. So let's see. For now, tenants who are behind on their rent can stay in their homes until the end of July. So they've gotten to the end of July. Before I know my producers already vetted and verified all that. I just thought I heard a different report yesterday because I know nationally it's being extended in some areas, and Governor Cooper expected and suggested the extension. And the group, though, however, rejected that. So I was just trying to make sure that we're giving you the right information. The vote was yesterday, so that's where it goes. Thank you so much, Amelia. And it's safe to say none of us won North Carolina's first $1 million vaccine drawing. Man, I can't ever win the lottery. I don't understand. I got 3 more shots at it. Anyway, a Winston-Salem mom of 3 had the honor, and I believe she's a school teacher. I think if I read that correctly. So congratulations to her. You know, we have to celebrate others' victories as well. And obviously, very well deserving. Who doesn't deserve $1 million? I'm not going to take it away from anyone. But I sure hope I get a shot at it. That's for sure. And a 14-year-old in Wilmington, she's the winner of the first $125,000 scholarship. Congratulations to her as well. I saw where she said she had just gotten a job, so she was trying to save up for college. Now, you love those kind of stories, I got to say. You know, and now she's got a $125,000 scholarship. So, you know, I think it's interesting, and I love what's happening with this because people that are, you know, trusting the system are getting rewarded for it. Well, some of them are. You get a shot at it. It's just like playing the lottery. What can you say? You know, the next drawing is a week from today. So we'll see who will be the next winner of $1 million. It just might be you. Who knows? All right. Things are starting to wrap up here. Let me tell you, on Friday, we will not have a Canceling COVID show. Of course, it's a holiday on Sunday, and a lot of people are taking off. So just so you will know, we're just taking off for the holiday, but we will be back on Wednesday with more exciting conversation and discussion. And hopefully you'll tune in then. I want to shout out Life Center International, where I saw Dr. Tricia Black's mobile unit was the Feast of Freedom opportunity that was happening on Sunday. And Life Center just loved on the community with, you name it, it was there, from food to masks to socks to prayer, and of course the opportunity to get a vaccine as well as get tested. All of that information was available. I believe the vaccine was just a conversation, but they weren't doing vaccinations. It was mostly testing because, again, it's important to know your status. I'm going to wrap things up. It's a hot day in the city with a great day to get out. As always, life's challenges make you better, not bitter. I'm Tonya Rivens. Thank you for joining us. Of course, continue to support us and our sponsors, Mecklenburg County Public Health, mecnc.gov, and of course, Groundwater Solutions. Have a great day, everyone. And remember, together, we'll continue to work to cancel COVID.